In this video, I'll be covering various Lefort fractures 1, 2, and 3. So, starting from the first one, the fracture line in Lefort 1, it runs horizontally above the floor of nose. Basically, it is the this line. Then, in walls, you can remember in walls by PALL, PAL. So, palate, alveolar process of maxilla, then lower third of septum. Of pterygoid, plates of sphenoid. All right. Then coming on to the other names. In other names, we have low level fracture, floating fracture, horizontal fracture. Now the clinical features. In clinical features, what we will see is there is going to be the ecchymiosis on palate, then there is going to be a floating maxilla, then swelling of upper lip, bleeding of nose, derangement of occlusion. Now let's talk about the level 2, that is the Lefort 2, sorry. Just to remember this, you have to remember that it goes on to like this, alright? So, it is basically called as pyramidal fracture, alright? Now, you must remember the wording as the same way that I tell you, alright? So, basically, the fracture lines run laterally, involving lacrimal bones, median wall of orbit, infraorbital border, fracturing through medial or medial wall of infraorbital foramen and runs backward beneath zygomatico maxillary buttress through lateral wall of maxillary sinus. Other names may it is going to have pterygoid plate or pterygoid fracture. Now signs and symptoms are very important. So first of all, I'll just explain this again. So these fracture lines, they run laterally, okay, to the lacrimal bones, median wall of orbit, and then infraorbital border. Then it goes on to the here. Infraorbital fissure is foramen is usually present, or basically it is present here. So it will go fracture through the medial wall of infraorbital foramen and then run backwards. यहाँ पे zygomaticomaxillary will be there, okay, so it runs backward beneath the buttress, then through the lateral wall of maxillary sinus. So this is the definition, all right, of the fracture lines. Now coming on to the signs and symptoms. So first of all, very obvious, there is going to be gross edema of soft tissue and middle third of face. Then bilateral circumferential circumorbital ecmosis. Then the keyword that you must remember here is dish face or dishwash deformity of face. Then retro positioning of maxilla with posterior gagging. Alright, now let's talk about Lefort 3. Now, Lefort 3 is basically a high level fracture. Now, why is it so? Because it is involving the craniofacial dysfunction or disjunction, basically. Craniofacial bones are involved. Alright, now what you will see is this fracture will go on to something like this. So, basically, what you are seeing is that the fracture line, it runs through the nasal bone and continues posteriorly, involving lacrimal bones, full depth of ethmoid, and then it runs around optic foramen, involves orbital fissure, pterygomaxillary fissure, involving frontozygomatic suture. Now, talking about the suture, let's talk about the clinical features. In clinical features, what you will see is you will see the lengthening of the face, then you will see an ophthalmos, CSF rhinorrhea. Now, very characteristic thing that you must always remember when you're mentioning CSF rhinorrhea is that it has a salty taste. Alright, then tilting of occlusal plane, then hooding of eyes, depression of ocular levels. So this completes the Lefort fractures. I hope you understood. I tried to make it as easy as possible for you to understand. So thanks for watching and do subscribe to my channel. Also, yeah, thanks.